Dr. Ferrer, the floor is yours.
Buenas noches, good evening, and thanks so much for being with us for this town hall. Tonight, I'm joined by Dr. Davis, the LA County Health Officer, Dr. Tereshita, the Associate Director of Acute Communicable Disease Control, Gemma Morales Myers, Director of Clinical Services, and Dr. Kim, Chief of the Education Sector Exposure Unit. To start, I want to tell you a little bit about how the town hall will go. We'll begin with some brief remarks from our panelists and then spend the rest of our time answering your questions. As a reminder, you can send in your questions in the chat on YouTube, Facebook, or Twitter. As displayed at the top, we also have live translation services during our event. Para escuchar en español, por favor, marca 0888-664-1453. For Mandarin, 888-664-1459. For Korean, 888-664-1454. Before we move to opening remarks from our panelists, let me share the most current information on the COVID-19 pandemic. As you're likely aware, we're currently in a surge with the highest case numbers we've ever seen over the last 2 years. And while case numbers and test positivity remain extraordinarily high, we're beginning to see significant declines from previous weeks. The average daily new case number is at about 24,000. This is down from 44,000 just a couple of weeks ago. And test positivity, which is the number of positive tests we get out of all the tests that are done on a given day, decreased this past week to approximately 13%, down from 17% last week. Hospitalizations have also started to decline slightly, and we're now averaging about 4,500 COVID patients hospitalized each day. And this is after we saw about 4,800 COVID patients hospitalized just last week. Unfortunately, because deaths lag increases in cases and hospitalizations, more people are dying this week than at any time since last March. This means that we're tragically reporting over 50 or 60 new deaths every day. Our hearts break for the families and friends that are mourning the loss of their loved ones. The path forward to reduce the number of daily deaths requires us to remain cautious so that we can help make sure that transmission drops to a low enough level that it poses less risk for those who are most vulnerable and less risk, frankly, for our recovery journey. With such high transmission, we have seen outbreaks skyrocket across every sector, and that has come with corresponding staff shortages that affect operations at schools, hospitals, businesses, and entertainment venues. To ensure that we continue to reduce transmission, we're going to need to use all of the public health tools and strategies that we know work to keep people from getting infected. Because we're in a different place today than we were just 1 year ago, we can reduce transmission even while continuing many of our customary activities if we layer in all of the protections that are now available and take personal responsibility for recognizing our individual role in reducing transmission, protecting those we love, and protecting those most vulnerable. This will require each of us to evaluate our personal health, the safety of those around us at work and home, and our work responsibilities before we make choices about how to gather, where to gather, and how to participate in all that LA County has to offer. Activities where people are masked, distancing, vaccinated, outdoors, and providing negative test results pose less risk. The more layers of protection, the safer the activity. Activities where people are unmasked, where there's crowding, where you're among people whose vaccination status you're unsure of, where you're indoors, and where there's no testing present are obviously more hazardous, particularly if there are multiple risks present at the activity. Taking steps to protect each other is still our very best path forward. Now, I'd like to turn it over to Dr. Davis, County Health Officer, for updates on masking and isolation and quarantine.
Thank you, Dr. Ferrer, and good evening, everyone who's joining us today. I'll be providing information and updates on the recent changes we made to our health officer orders regarding masking and our isolation and quarantine orders. First off, our health officer order has been modified to include additional safety measures to reduce transmission, knowing that vaccinations alone are not sufficient to prevent spread of Omicron, and not everyone in our county is vaccinated against COVID-19. Employers are now required to provide their employees who work indoors in close contact with others with well-fitting medical masks, surgical masks, or higher-level respirators, such as N95 or KN95 masks. These upgraded masks, when worn correctly, are better at blocking virus particles from going through the mask. These modifications recognize the importance of wearing well-fitting, high-quality masks that do the best job filtering out the virus when in close contact with others. In regards to isolation and quarantine, these requirements apply to everyone except healthcare personnel who have their own guidance. Our health officer order was updated to align with the state of California guidance issued earlier this month. First, I'll cover isolation requirements. Thank you. I see the slides are up now. Appreciate that. Regardless of vaccination status, all persons who are considered to have COVID, if they have a positive viral test and or their healthcare provider thinks they have COVID, everyone must isolate from others. And everyone infected with COVID is required to remain at home and away from others for at least 5 days. And in order to exit isolation after day 5, you'll need to have a negative COVID-19 viral test that was collected on day 5 or later. You'll also need to have no fever for at least 24 hours without the use of fever-reducing medicines like acetaminophen or ibuprofen, or be asymptomatic, or your symptoms have to be improving. That's the other. If you don't meet these criteria and you do not test on or after day 5, you can exit isolation after day 10, provided again that you have no fever for at least 24 hours without the use of fever-reducing medicines, and you are asymptomatic or your symptoms are improving. Now, if you exit isolation early, you will need to wear a well-fitting medical mask around others, both indoors and outdoors, for a full 10 days from the time that you were diagnosed. This is particularly important for those exiting isolation after day 5. This step is important and applies to everyone who is tested positive and who interacts with anyone in their household or isolation location. Next, I'll move to quarantine. We also modified our quarantine requirements for persons in LA County who are exposed to COVID-19 and need to quarantine. These specific requirements apply to those individuals with an exposure who are unvaccinated or incompletely vaccinated. You will need to stay home for at least 5 days after your last contact with a person who has COVID-19. Your quarantine can end after day 5 only if symptoms are not present and a COVID-19 viral test collected on day 5 or later is negative. If a test is not done on day 5 or later and symptoms are not present, quarantine can end after day 10. If you have been exposed, be sure to monitor your health for 10 days. If at any time symptoms develop, test, stay home, and begin isolation that I just went over earlier, and that's located on the screen that we have shown before. You will also need to wear a well-fitting medical-grade mask around others for 10 days after your last exposure. Again, that additional layer of protection. Students in grades TK through 12 may also attend school during quarantine period if they are fully vaccinated and not boosted or qualify for a modified quarantine that may be offered by their school. Those who have no symptoms and are up to date on their COVID-19 vaccines or have recovered from lab-confirmed COVID-19 within the last 90 days are exempt from quarantine should they be a close contact. And up to date means that you're fully vaccinated and not booster eligible, or you're fully vaccinated and have received your booster. However, all those exempt should monitor their health for 10 days. And if symptoms develop, again, please stay home and test. If you do test positive, you will then need to follow isolation requirements. And you will also need to wear a well-fitting medical grade mask around others for the 10-day quarantine period. Whenever possible, all close contacts should try to test as soon as possible after exposure, and again around day 5. This is especially important if you yourself or someone you live with is at increased risk for severe illness from COVID-19. The exception to this is those who recently recovered from COVID-19. For these individuals, testing is not recommended unless you develop symptoms. Again, if you test positive or if you have questions or need help, you can always contact the Department of Public Health 7 days a week between 8 a.m. and 8:30 p.m. at 833-540-0473. Again, 833-540-0473. We ask that you please also tell your close contacts that you've been exposed if you are diagnosed with COVID-19 and that they need to follow instructions for close contacts. The number, once again, is on your screen. It's 833-540-0473. Again, that line is open 7 days a week. Now I'd like to turn it over to Dr. Dawn Terashita, Associate Director of Acute Communicable Disease Control Program, for more information about the effectiveness of vaccines and boosters against Omicron.
Thank you, Dr. Davis. I'm honored to be here this evening to discuss the Omicron variant and how effective the COVID-19 vaccines are at protecting you and the ones you love most. I will also briefly talk about getting your booster dose, including when you are eligible and where LA County residents can get their booster dose if they have not done so already. First, let's address what we now know. We know that Omicron began as a SARS-CoV-2 variant of concern because it shows increased transmission, some escape from vaccine protection, and some resistance to treatment. Early data suggests that the variant was spreading rapidly and may spread several times faster than the Delta variant. What we now know and have been experiencing is that this variant is highly contagious and can spread incredibly fast from persons of all ages. However, while spread of Omicron has extended across the county over the past 2 months, the risk of infection, hospitalization, and death is not equally distributed, as there are significant differences by vaccination status. Now we will look at the 7-day cumulative age-adjusted case rates per 100,000 people by vaccination status from June 1st, 2021 through January 15th, 2022 in Los Angeles County. The top dotted line represents the age-adjusted case rate for unvaccinated cases. The dashed line represents this rate for fully vaccinated individuals who have not received an additional dose or booster dose. And the solid line at the bottom represents this rate for those who are fully vaccinated and boosted. While cases have risen dramatically among all individuals, the rate of infection are substantially higher among individuals who are unvaccinated. For the week ending January 15th, those fully vaccinated with 2 doses of Pfizer or Moderna or 1 dose of Johnson & Johnson, but were unboosted, were approximately 2 times less likely to get infected than vaccinated people. Those who were fully vaccinated and boosted had even more protection, as they were more than 4 times less likely to get infected than those unvaccinated. Research shows that the effectiveness of vaccine wanes over time, so getting boosted becomes more and more important as we face the current surge and explosion of the circulation of the Omicron variant. We have significant evidence of this right here in our own county and across the United States. Booster doses are most important for everyone age 12 and older and are due at 5 months after your second dose of Pfizer or Moderna vaccines, or 2 months after your first dose of the Johnson & Johnson vaccine. In particular, we must protect our most vulnerable, those 65 and older, and those who are immunocompromised. So far, we've boosted almost 3.1 million people in LA County. Just as many people evaluate their health at the beginning of the new year. You should check your vaccination card and calendar to see if it is time to get your booster. It is the best way to start out a new year. Millions more people in LA County are currently eligible to receive boosters. Remind your family members today, particularly our seniors, to get boosted. Do not wait. As Dr. Furr mentioned, our case numbers are still in the tens of thousands each day. We are seeing more people die from COVID as well. Please visit vaccinatelacounty.com or vaccinatelosangeles.com for vaccination sites near you. Many locations across LA County do not require an appointment. Additionally, public health provides in-home vaccination appointments for people who are homebound and are unable to visit a vaccination site. Please visit vaccinatelacounty.com to fill out the online request form or call the DPH Vaccine Call Center at 833-540-0473, open daily from 8 a.m. to 8:30 p.m. Thank you, and I'll now turn it over to Dr. Andrea Kim to talk about schools.
Thank you. I hope that you can hear me. So thank you, Dr. Tereshita, Dr. Davis, and Dr. Ferrer. Good evening, everyone, and Happy New Year. It's wonderful to be here with you tonight, and we are really grateful that you're tuning in so late. I'm going to be updating you on our COVID situation at schools and how we continue to keep students and staff safe on our campuses. So first and foremost, the COVID-19 vaccine is the very best way to protect children from COVID sickness. We're encouraged that already more than 15 million children ages 5 and older have safely received the vaccine across the county. However, we still have 655,000 children between the ages of 5 and 11 who have not yet received their first dose of vaccine. So there's still a lot of work that needs to be done to close this gap. We continue to see racial inequities in vaccination rates, particularly Latinx and Black children, with only 1 in 6 having been vaccinated. This is especially concerning because of the recent increases in cases of students and staff due to the Omicron surge. For the week ending January 23rd, so a few days ago, out of about 555,000 tests that were conducted by schools across LA County, close to 41,000 positive cases were identified among students and staff. This reflects a positivity rate of 7% among those tested at school. Now, this represents a 33% decrease from last week's school positivity rate of 11% and a 50% decrease from the week prior to that when school testing positivity peaked at 14%. While this is really encouraging and following similar hopeful downward trends we are seeing in the community, it's really important to note that these rates are still much higher than our rate before Omicron, which was approximately 0.2% of those tested at schools. So given that our school case numbers are still quite high, we're prepared for the potential for more outbreaks at school and additional spread in the community. And this is why we encourage parents to get their children vaccinated. Again, this is the very best tool we have for protecting children from sickness and from spreading infection to others. There are more than 1,000 fixed vaccination sites in the county, including 190 mobile clinics this week at schools. These vaccine clinics offer doses for children ages 5 through 11, as well as boosters for eligible students ages 12 years or older. Secondly, testing is another important tool to stop the spread of COVID-19 at our schools. And schools are working really hard with public health as well as with the LA County Office of Education to increase testing capacity to better manage potential school exposures while supporting in-person learning for as many students as possible. Earlier this month, we distributed over 1.4 million test kits that were received from the state's program to 80 school districts and more than 300 charter schools as students were returning to school after the winter break. This helped to identify tens of thousands of infected students prior to returning to school, enabling them to isolate safely at home. Public Health is also working with the White House and CDC to access rapid antigen test kits for school districts. And in addition to that, we're prioritizing 1 million home test kits to be distributed in the coming weeks to schools in the most vulnerable neighborhoods as measured by community health indicators and child and adolescent vaccination rates. Our third set of prevention actions for schools is around masking. Masks continue to be one of our best tools for prevention in the community and at schools. Currently, all school staff have been issued and are required to wear medical grade masks, such as surgical masks or a respirator. Students are also advised to wear upgraded non-cloth masks of multiple layers of non-woven material with a nose wear that fits well. And finally, our fourth action is around exposure management at school. What should school do when they have 1, 2, or 3 or more cases? During this surge, the highest priority for schools for exposure management is going to be the identification and isolation of COVID cases on campus, and this will help prevent outbreaks from occurring at school. All infected students and staff are required to isolate at home away from others. Asymptomatic students and staff that test negative on day 5 of their isolation period have the option of testing out of isolation and may return to school on or after day 6 of their isolation period. As Dr. Davis had mentioned, returning students and staff that test out of isolation must remain asymptomatic and always wear a high-grade mask when around others, both indoors and outdoors, until the 10 days have passed from their positive test or the day their symptoms began. So thank you very much for listening in, and now I'll turn it over to Gemma Morales-Meyer.
Thank you, Dr. Kim. Good evening, and thank you for joining us. As Omicron continues its rapid spread throughout the county, there are 3 important steps we should take. First, as others have mentioned, vaccines remain the best way to protect yourself and those around you. They are safe and effective and recommended for everyone 5 years old and older. Vaccinations are always free and open to eligible residents and workers, regardless of immigration status, and appointments are not needed at public health vaccination sites and at many county sites where first, second, and third doses are available. To find a vaccination site near you or to make an appointment, please visit www.vaccinatelacounty.com. If you need assistance, you can also call 1-833.
Emma, can I just interrupt you for a second? Because you're coming in really faintly. I don't know if you can get closer to your mic.
Sure, let me see if
Or
this
just
works a little
yell
bit.
louder. Sorry.
I'll try to project a little bit more.
Much better.
Great, thank you. To find a vaccination site near you or to make an appointment, please visit www.vaccinatelacounty.com. If you need assistance, you can also call 1-833-540-0473 for help. Finding an appointment, connecting to free transportation to and from a vaccination site, or to schedule a home visit if you are homebound. We know that vaccinations provide powerful protection against COVID-19. But the number of children ages 5 to 11 with at least 1 dose stands at only 30%. This is far below all other eligible age groups across LA County and creates significant vulnerability for increased spread of COVID. Also, the data continues to show us that our immune systems need to be boosted. So we urge you, if you are eligible, to get your booster vaccine for this additional layer of protection. If you are 18 years or older, you should choose either the Pfizer or Moderna booster, even if your first vaccine was the Johnson & Johnson. If you are age 12 to 17, you should get the Pfizer vaccine booster. Also, you should get your booster dose 5 months after your second dose of Pfizer or Moderna, or 2 months after your Johnson & Johnson dose. Again, to find a vaccination site near you, go to www.vaccinatelacounty.com or call 1-833-540-0473 for help. The second crucial tool to slow the spread of Omicron is testing, and we have several ways you can do this, as you can see on this slide. A new federal program mails free antigen test kits to your home. Every U.S. household is eligible to order 4 free at-home COVID-19 tests at covidtest.gov. Orders ship in about 7 to 12 days. Insurance companies are also now required to reimburse you for 8 tests per month for each individual on your plan, up to $12 per individual test. Again, for the free federal test or to learn more, go to covidtest.gov. Also, there are currently more than 189 community testing sites, 21 county-run sites, 7 state-run sites, and 36 pop-up testing sites. We encourage all LA residents to visit covid19.lacounty.gov/testing to find a convenient testing location near you. Finally, the third way we can protect ourselves and our families is if someone tests positive, they must follow isolation requirements and notify all close contacts. If you test positive and have questions or need help, you may call the Department of Public Health 7 days a week from 8 a.m. to 8:30 p.m. at 833-540-0473. As Dr. Davis mentioned, when you test positive, first, it is important to determine your isolation period and stay home according to the requirements. These requirements apply to everyone except healthcare personnel. It's very important to also tell your close contacts that they have been exposed and they need to follow instructions for close contacts. Finally, if you have COVID, you need to also wear a well-fitting medical grade mask around others, both indoors and outdoors for 10 days. This is particularly important for those exiting isolation after day 5. N95, KN95, and KF94 are the best when it comes to blocking COVID. The surgical masks, especially when doubled, also work well. And now I'll turn it back over to Dr. Ferrer so we can start answering questions.
Yeah, thank you so much to everybody, all of our panelists. I think the information you provided was great. We do have a lot of questions that have come in, so I want to thank everybody who's been listening and submitted their questions. And we're going to just get started because we've got dozens and dozens of questions here. Dr. Davis, I'll start with you. If we have so many people vaccinated, why do we still have to wear masks?
This questions about masks constantly come up. Vaccines aren't 100%, and we've shown with the data that they do have lots of benefit in terms of reducing the risk of becoming infected. And if you do unfortunately become infected after being vaccinated, that you still have prevention and protection from being hospitalized or dying. And then for those who are vaccinated and do become infected, they can still transmit as well. So there's tremendous benefits in terms of trying to prevent and protect you from being infected, as well as having severe consequences if you are infected with the vaccinations. But really, the masking is just an additional layer in order to protect all of us, given the high level of transmission that we have. If you go back to thinking about what the CDC recommended and when we put masking in place, we had gotten into substantial community transmission, then progressed to high. And at this point, we're at extremely high in comparison to the thresholds and the indicators for community transmission. So until we get down to a much lower level, and as we talked about before, being in moderate or low transmission, we continue to need this additional layer of protection.
Thank you so much, Dr. Davis. And I'm going to, sort of a very related set of questions that have come in. Maybe Dr. Terashita, you could help answer these. It's hard for me to understand how come vaccinated people can still get and spread COVID. I thought these vaccines were working so that we wouldn't get infected.
Thank you, Dr. Ferrer, and thanks for that question. As Dr. Davis just mentioned, the vaccination is the #1 way you can protect yourself from COVID. No vaccine is 100% effective. So there is still small chances that you can get and spread COVID. I think the most important thing we've learned about COVID is that if you get vaccinated, you could get infected, but your chance of getting a severe infection, getting hospitalized, getting put on a ventilator, or even dying are much, much, much lower if you are vaccinated. And if you get boosted, your numbers are even lower still. So this is a pretty strong incentive to get the COVID vaccine. And also you want to prevent having your loved ones, your friends, your family get infected. Even if you are younger and healthier and think you would survive an infection, you see people you love who are also at risk. So do your part, protect your family, your friends, your community, and get vaccinated. Dr. Ferrer, I think you're still muted.
Yeah, thank you. I'm going to follow it up with a question, that's very related. It doesn't make sense to me. I feel like the vaccines aren't working if I get infected. How do you know that they're working enough to keep me from getting sick if I'm getting infected?
Sorry, was that question for me?
Yes, I'm going to stay with you, Dr. Terashita. Thank you.
It's really hard to know a vaccine's working because a vaccine is protecting you invisibly. Like, you can't know that the vaccine is working. The best way to know is that you should talk to the experts, talk to the people you trust, like your doctor. Look toward the agencies that guide us, like the CDC or LA County Department of Public Health, to see what the latest data are. We presented some data today that's showing how vaccine is clearly protecting those who are infected from severe infection, hospitalization, and death. We also can see similar studies coming out nationwide as well as internationally. So that's what I would recommend. The best thing to do would be, also, I always encourage everyone to talk to your healthcare professional if you have individual questions about yourself, because everyone's a little bit different.
Yeah, I think these are such important questions. So I want to thank folks, because we know how confusing it got as soon as so many people who were fully vaccinated and even boosted started getting infected. But almost everyone who's vaccinated, and especially who's been boosted, is not in the hospital. We have hardly anybody in the ICU, in the intensive care unit, that's vaccinated and boosted. The numbers are really almost zero. So that does tell us that the vaccines work to do what they really have to do, which is keep us from getting really sick. But we know how confusing these times have been, because so many people who did the right thing, got vaccinated and got boosted, still ended up developing an infection. But I do know that, just from talking to folks and just, here at work, just about everybody who was vaccinated and boosted had very mild illness. Most people will say, I'm so relieved I did get vaccinated, because, this was like having a bad cold. I felt lousy for a few days, but then I felt better pretty quickly. For people who aren't vaccinated and aren't boosted, tragically, many of them have ended up in our hospitals, and some, as we've announced every day now for the last couple of weeks, increasing numbers of people are now starting to pass away. I'm going to move on to Ms. Morales Myers about some questions about vaccines. This question is about boosters. I did get my booster, but I really want to know, am I supposed to get another one? It's been almost 5 months. Should I be coming in after 5 months, or should I be coming in after 2 months? When am I getting the next booster?
So the primary series is the first and the second dose. After that, the CDC recommends that you get a booster for Pfizer and Moderna. It's recommended 5 months after your last dose of the primary series. And for J&J vaccine, a booster is recommended 2 months and after. Currently, only one booster is recommended unless you are immunocompromised.
Yeah, thanks so much. I think I think I'm so glad people are raising these questions, because I think there is a lot of concern, as many people got their boosters early last fall and they're like, oh, do I need another one? We have to wait for CDC and the FDA. Their scientists are looking at whether or not we need that additional protection. Right now, as you can see from our data, these boosters are working really, really well. So people should feel pretty comfortable that they're well protected with the booster dose that they got. And I guess I would say the most important thing is, if you didn't get your booster yet and you're eligible, it makes perfect sense right now to act with some urgency while we have so much Omicron circulating. and go ahead and get that extra protection with your booster. I'm going to go ahead, Dr. Kim. So a bunch of questions about schools. So thank you. We know a lot of parents are on with us tonight. If 5 positive cases are found in a single classroom through the weekly testing, shouldn't there be a different protocol to the students that were in that classroom than just monitor your symptoms? And how do you decide whether or not these cases were epi-linked or passed on in the school setting, or they were actually people independently got them while they were out in the community?
Thank you, Dr. Freer, and thank you for that question. I know it's really challenging to keep up with our guidance, and just recently we did update our guidance to really help around the quarantine and to deal with the surge that we are facing right now. But let me just talk about these 5 cases in a single classroom. So if these 5 cases were in the same setting during the same time period, well, either of the cases were infectious. And so just to review, what does infectious mean? A case is considered infectious from 2 days before their symptoms first started, or the date of their positive test if they don't have symptoms until the isolation period ends. So if one or more of those cases were infectious and they were all together at the same time and place, then this would actually qualify for meeting our outbreak criteria, which is 3 or more epidemiologically linked cases within a 14-day period. So if a school thinks that they have 3 or more cases that are linked in this way, they should really contact public health immediately to report this cluster so that we can confirm this information and we can see, were they sharing that same time and space? Does this look like there's ongoing transmission, and whether an outbreak response is needed to stop spread? Thank you.
Dr. Kim, do you want to just talk a little bit, because I think this parent rightfully was sort of like, well, my child was in that classroom, they're not infected, but all my child got told to do, because they were fully vaccinated, is just monitor themselves for symptoms. I feel like there's more risk involved here. So I wonder, if we could just sort of talk to, why we really do sort of rest for people who are fully vaccinated on this idea that they should just be careful and monitor their symptoms.
Right. So we did make some changes to our guidance around isolation and quarantine, and this really was to align with the state. So the state a couple of weeks ago came up with some new guidance for schools in order to make sure that children can be in school and remain in school safely. So there are 2 groups of students with an exposure. There are going to be your fully vaccinated students, regardless of whether they're boosted or not, or booster eligible or not. And then you've got your students who are not fully vaccinated. So the fully vaccinated students are considered exempt from quarantine, which means that they can come back to school as long as they are without symptoms. And as long as they are masking, they upgrade their mask for that 10-day quarantine period. So they need to wear it at all times at school, indoors and outdoors, except while they're eating or drinking. And then additionally, we want them to get tested. If right now there's so many cases right now, and schools are struggling with testing, it's really difficult to find tests. If a school does have testing capacity, and we're working with schools to be able to meet that demand, then we would want that child, that fully vaccinated child who's exempt from quarantine, to still test. They should still test, and California State does recommend that they still test because of that exposure. So that's that one group of students that, they come to school, they monitor for their symptoms, and they get tested if the testing capacity is there. And they're fully masked that entire 10-day period post-exposure. The other group of students is the one that we're most concerned about. Those are the students that are not fully vaccinated, because we consider this to be the most vulnerable group of students. They're at higher risk of getting infection. They're at higher risk of spreading and transmitting to others, and they're at higher risk for more negative outcomes, more health outcomes. So we want, for this group of students, they can come back to school after an exposure, but they're required to test. So that that testing that we said, you know, okay, if capacity allows for your fully vaccinated, that doesn't apply for your unvaccinated. We really need them to get tested, and that testing should happen between days 3 and 5 of since their last date of exposure. So we really look at that risk differential, and I know that this is sometimes a scary time because we're thinking, okay, there's a lot of Omicron out there. Why are my students coming back to school? We have a lot of evidence that shows that schools are a very safe environment because they have those layers of protection in a very supervised setting. So you've got your testing, and you've got your masking, you've got your monitoring of symptoms, and you have your vaccinations to really help with that comprehensive prevention approach. Thank you.
Yeah, thank you so much, Dr. Kim. You know, Dr. Davis, again, these are such excellent and important questions. Do you foresee COVID dying off, or is just going to be mutation after mutation with new variants?
That's a great question. I think all of us have sort of watched this evolve over the course of 2 years, where we've seen new variants show up. Sometimes they're acting differently, meaning they're more infectious or may cause more severe disease. And that's always possible as long as we continue to have infections, and especially at this level of infection. So there's a chance that maybe it does die out. Maybe the new variants of the virus just aren't weak, and they're weak and they don't survive as much, and they don't transmit as well. That's always a possibility. But as I said, we've seen mutations over the years. That we've seen COVID, and so it's possible that it'll be here. But hopefully, we get to a point where there's much more protection. Whether people are vaccinated or whether there's some more lasting immunity for those who were infected, and hopefully they got vaccinated as well, which is the best protection. But in either case, it's hard to predict, but we can go off of what we've seen over the past couple of years, and hopefully, we get to a point where really what's circulating is not that strong in terms of transmission and doesn't cause severe disease.
Thank you so much, Dr. Davis. I'm going to go back and Dr. Terashita, a couple more questions here for you as well. This is a question from one of our listeners tonight. My aunt is still unsure about getting the vaccine. I tell her it's safe, but she doesn't believe me. How many people have had bad reactions to the vaccine? And what is considered a bad reaction?
Yeah, thanks for that question. And it is something that everyone wonders, how safe is the vaccine? No vaccine is 100% safe. There are always a certain amount of people who will have what we call local reactions to vaccine, and this is really any vaccine. These can include things like headache or tenderness or redness at the site of the injection. You could have a little fatigue or tiredness. And these are very common kind of local reactions after you get the vaccine. Maybe like between 10 and 30% of people will have such a reaction. More severe reactions, however, are extremely rare. I would tell your aunt, or tell you to tell your aunt, that these mRNA vaccines are very safe. They have been studied, they have been reported on, and we follow up on every adverse reaction that we hear of from a healthcare provider on a vaccination, and it is required to report by law. So we follow up on all these. Very, very few adverse reactions. I would say an adverse reaction is something that is more than a local reaction. So you feel sicker than just some fatigue or some headache or some tenderness. You feel worse than that. Maybe you are required to see a healthcare provider. Hard to define what an adverse reaction is or what a severe adverse reaction is. But again, I would counsel you to tell your aunt it's a very safe vaccine. And what I always do, or I tell my patients to do, is to weigh the risks and benefits. Like, what are the chances of having a severe reaction from a vaccine versus having a severe reaction from COVID? And data is pretty clear. You're much more likely to have a severe event from COVID than from a vaccine. Thank you.
Thanks so much, Dr. Terashita. I also think it's important to note the most severe reaction that people can have is a severe allergic reaction. And that, again, to any vaccine, that's a possibility. And that is why you're waiting 15 minutes, sometimes 30 minutes, if you have a history of allergies after you get the vaccine at the site where you got vaccinated. So that we can make sure that you don't have that allergic reaction. But if you do have an allergic reaction and you're still, at the site, we're going to be able to treat you right away so that there's no devastating consequence from that, because there's medication that you can be given. But that is one of the more common worries is, will I be allergic to this? You're going to stay, the vast majority of people who have an allergic reaction, they have it right away. And that's why you stay, you're watched in what we call observation. We make sure everything's okay. And then you go ahead and you go on your way. So again, I think, at this point, hundreds of millions of people have been vaccinated with Pfizer and Moderna just in our country alone. And then there's hundreds of millions of people with Pfizer and Moderna across the world and other vaccines. And those rare adverse events that none of us would want to have happen are extraordinarily rare. Just tiny percents of people. Well less than 0.01%. I mean, it's really, really small numbers in comparison to all the people who are getting vaccinated. So hopefully, like most of us, that provides enough reassurance that we think the benefits are going to far outweigh the risk of getting COVID. We have many, many more people who are seriously ill and tragically dying from COVID than we have anybody who's got those kinds of reactions because they got vaccinated. So just want to, really make sure everybody feels comfortable asking these questions, getting information from us, and then again, talking to others to make sure you feel good about the safety of these vaccines. And again, in our country, anybody can report an adverse event, and then it gets investigated. Like our team investigates from that, people fill out that form, they say, I had a bad event, and then somebody will follow up to see, was this really a bad event associated with the vaccine, or was something else going on? And then, you've seen the pauses on Johnson & Johnson when people were looking at, was there something that really required us to be more cautious about in administering those doses. So we're lucky in this country that we have such a layered effort to really make sure that these vaccines are given with safety as sort of the number one consideration. I'm going to go on to talk with Ms. Morales-Myers again about vaccines. I want my daughter to get vaccinated, but she is really scared. What can I do to help her feel better? And can I sit with her when I take her to get a vaccine?
Yes, absolutely. We know that some kids do great with vaccines and others, well, they don't do so well. So being there for your child is important, and also talking to them ahead of time on what to expect, what is going to happen while they're there, what the process is, helps to relieve their anxiety. And of course, you being present also helps relieve the anxiety, so that we hope you are there.
Thank you. Dr. Kim, my wife works at a school in Compton that has about 700 students, and there have been 60 students and staff that have tested positive, obviously who were on the campus getting tested. Is this considered an outbreak automatically? And what would need to happen for the school to shut down? Because the school didn't shut down.
Right. So we were seeing a lot of this over the last few weeks after students were returning from their winter break. And as you know, we had extraordinarily high numbers in the community. And of course, that did, got transmitted within families. But, I do want to just repeat what I had earlier said, is that a school-associated outbreak is when there are 3 or more cases at a school within a 14-day period. And those cases are epidemiologically linked at school. So they were at the same place at the same time at school when at least one of those cases was infectious. So the example that's provided, again, is not uncommon in these first weeks after winter break. These large numbers are primarily coming in from the community instead of school. So meaning maybe a household member or a friend in the neighborhood was infected and then it got spread to other adults and children. And then a lot of people also acquired community infections right before school started. And then, then they came to school and then, there was a testing program and maybe they got tested on Wednesday after they came to school and they were diagnosed. And that infection actually reflected something that came in from the community. So in any case, a lot of that was happening and it was really hard to differentiate, okay, this is community transmission. We definitely know that, but what's actually happening on the school campus? And so right now where we're at, 3 weeks after students have come back from winter break, we now have a better idea. Right now, all of that return from winter break, those infections have now been isolated. Now we've got a lot of infection, we've got a lot of cases, and we've got a lot of contacts at school. And we are expecting a lot more outbreaks to happen. So when we have a better ability now to actually, schools can identify these clusters, they can report that to us and we can investigate and we can determine whether or not this is an outbreak that we need to respond to. In terms of what needs to occur to shut down a school, so that decision is going to be at the school level. At the public health level, we do not want to shut down schools. There are measures that we can put into place to really stop transmission from happening. But if you're at the school level, your family or an administrator, and you feel like the situation is unsafe, it's a gradient there, then you may have that ability to make that decision. But at the public health level, we don't shut down schools. I mean, that is something that is a decision by a school district or a school. Thank you.
Yeah, thank you so much, Dr. Kim. And I want to just clarify a couple of things. One is that because there is so much transmission in the communities, what's happening at the schools is this is the one place where we're doing a lot of testing. So just about every single school was doing testing as students and staff came back. So like Dr. Kim said, most of what we were finding initially were people who had gotten infected over winter break or right before they came back to school, or even right after they came back to school. But it wasn't necessarily because somebody at the school was infected and they got infected from that person. But with this much transmission, and even though our rates are going down, they're not going down fast enough or far enough down for us still to not to have a lot of transmission. We are going to see more outbreaks at school. But I want to note that when we say we're going to see more outbreaks at school, the first 2 weeks that schools were open, there were 3 outbreaks for the whole week across all 80 districts and all private and public schools that we could verify were outbreaks. And even this past week, it was 11 outbreaks. Our schools have done a really excellent job at trying to prevent large outbreaks from happening. The vast majority of the outbreaks we've seen have been on the sports teams, and they've usually been associated with what I would call non-school activity. Locker rooms, perhaps, traveling, going to Arizona for the tournament, going out to dinner to a hotel, all have really made sort of spread a lot easier on the sports teams. And then the second place where we see more outbreaks is with the elementary school children. And that directly relates to the fact that we don't have high vaccination rates yet among most of the children in our elementary schools. So it's pretty easy for there to be spread. And because they're younger children, they tend to be together and closer together more. It's older children, I think, understand trying to distance, keep their space, be super careful. It's much harder with younger children. But the decision to close a school is something that would be made, obviously in consultation with us. But Dr. Kim is right. We respect the autonomy of the school districts, and we also acknowledge that there could be other reasons for closing a school that are not related necessarily to an outbreak. So for example, if you had enough staff or teachers that weren't able to come in because they were sick and staying home, you might have to close the school if you didn't have enough bus drivers. So again, because there's so much community transmission, we have staffing shortages. People should understand it's a complex decision that needs to get made. And then front and center for everybody is trying to make sure that we're ensuring safety for both teachers and staff, as well as for students and their families. But thanks so much. And again, these are really, really important questions. I want to go ahead and go back to Dr. Davis. We have a ton of questions that have come in, Dr. Davis, around masking. Why do we have to still mask? So I'm going to try to put them together. Is why are we masking if we're vaccinated? That doesn't seem to make sense. So we still have people sort of thinking because they're fully vaccinated and boosted, they don't really need to wear their mask. And then we have a whole host of questions about when are we going to lift the masking requirements? What would it take for us to not need to wear masks whenever we're indoors? And a lot of it's specific to schools, but daycares, workplaces. So I just wonder, Dr. Davis, if you wouldn't mind spending a few minutes talking about masking. And other people should feel free to chime in as well.
Yeah. So, as mentioned before, the CDC guidance is that even if you're fully vaccinated, if you're in an area with substantial or high community transmission, you should still wear a mask as an additional layer of protection. And so that's, what we are holding to. It makes a lot of sense. Again, mentioning that vaccines aren't 100%. Also, as we've gone through the Delta surge and now the Omicron surge, we have seen, even being fully vaccinated, that the effectiveness of the vaccine dropped down a little bit. And so we had people who were fully vaccinated becoming infected, with the Omicron variant. And those who were boosted, we saw their effectiveness drop down some as well, but not as much as those who were just fully vaccinated. So all of these things, given the high level of community transmission, means that we should have a number of layers of protection in order to prevent spread. And that is really what this is about. When the risk goes down, when the community transmission goes down to low, you're less likely to run into someone who has the infection who can transmit it to you. But until that time, we must continue to maintain layers of protection in order to slow the spread of the virus. But again, vaccines are protective, not 100%, but very much protective versus being unvaccinated. It's safer to be vaccinated than it is to get COVID-19 and think you're going to rely on natural immunity. We do have people that have been infected before that are getting reinfected. Everybody who's infected can transmit. And when you have this level of transmission, we have to have multiple layers of protection, and masking is one core protection that we have. I'll also note, just with the masking that we've done so far, we've had really low transmission of influenza. So there are some other benefits as we've gone through this winter as well. But we have said in the beginning, when we first put masking back in place indoors for everyone, regardless of vaccination, that we'll consider it once we get down below substantial and are into moderate transmission. And we'll take a look at some other factors in terms of what's happening with whatever's circulating at that time, if the vaccines appear to be effective against whatever's circulating. These are things that we have to consider, but we're doing our best to make sure that people understand and that people do the things that are needed, given the high level of community transmission that we have right now.
Thank you so much. And Dr. Terashita, I'm just going to follow up with a question that Dr. Davis, started talking about, but this is a question about, can we acknowledge that people get a lot of immunity when they've had a previous infection? Why aren't we considering that immunity as being equal to getting vaccinated?
That's a good question. Thank you, Dr. Ferrer. It's complex. There have been some studies that have shown that natural immunity, meaning you were immune because you got the infection, actually wanes pretty quickly with COVID infection and Omicron. And when you compare it to the immunity you get from vaccine, it's actually much shorter. So vaccine will provide a much longer protection than natural infection. So for many reasons, we recommend that you get vaccinated even if you had the infection. And the guidelines say that as soon as your isolation period is over, as soon as your symptoms have improved and you are no longer required to be in isolation, you can get vaccinated. And this is the best way to protect yourself.
Yeah, thanks a lot. I mean, I will, sort of just add a little bit to this. And, unfortunately, lots of people remember we went straight from Delta to Omicron, really. I mean, we had a little bit of a tiny break, and then, we got clobbered with the Omicron variant. A lot of people had gotten infected with Delta. I know that many of you remember, we had pretty high infection rates back, late summer, early fall from the Delta variant. And it turns out that the people who got infected with Delta, unfortunately, didn't get a lot of protection against Omicron. So we have what we call lots of reinfections, people who were previously infected with one strain of the virus now getting another strain of the virus. It turns out that the vaccines, while again, as we've noted, they're not perfect either. From the very beginning, this has been like now over a year, the vaccines, particularly if you get boosted, have been effective around, we've had really 4 different strains of the virus that we know of circulating since we began vaccinating. And the vaccines have proven to be relatively effective against all 4 strains. So again, I think we have to look at the evidence. We understand that there is some natural immunity and it actually works to our advantage when we're in the middle of this large surge, but it's not enough protection that it should mean that you don't need to then go ahead and still get vaccinated. So I think that's it. It's not like we're saying, oh no, you didn't get any immunity from getting sick. You obviously did get some natural immunity. It just looks like it doesn't last long. And with a mutating virus, your best bet is to actually get that vaccine, which seems to provide more durable protection than just going ahead and relying on your natural immunity. And again, I want to thank folks for this question. And Ms. Morales Myers, I want to just move to you again. Similar questions. If an unvaccinated child gets infected with COVID-19 and the Omicron variant, should they still get the vaccine? And when should they get the vaccine?
So yes, definitely, as Dr. Tereshita just explained, we encourage everyone that has tested positive for COVID-19 to receive the vaccine. And the recommendation says when their isolation period is over and their symptoms have resolved.
And does that go, would that be the same for people who didn't get boosted? So I didn't get boosted, I got infected with Omicron. Should I now go ahead when I get better, when I feel better and I've finished my isolation period, should I go ahead and get my booster dose now?
Absolutely. It's important to receive a booster as we know that the vaccines offer the most protection against COVID-19. And as you also explained, there are studies out there that show that people who tested positive for COVID and didn't get their booster vaccine were more likely to get COVID again compared to those that did get vaccinated after testing positive. So it's important to still get your vaccine even though you've had the infection.
Thank you. Oops. Thank you for that. I'm going to go ahead and go back to Dr. Davis. Again, sort of staying on this theme just for a second around vaccines before we switch. This is a question about will there always be vaccine mandates, or will we be able to get rid of all of the vaccine mandates once we get done with like this big surge, or we feel like the pandemic is coming to an end?
That's a great question. I think, during an emergency, when you're having a surge, when you've been in this for 2 years, there are things that you want in place in order to have the most protection within the community. I can imagine that as we continue to move forward and as we observe, there may be other things that happen, where vaccinations, become required, whether it's in schools or whether it's for healthcare workers, that there's no order like you have right now, during this emergency. But in either case, we have done things, during this emergency in order to put safety measures in place to try to reduce the impact of what we've been dealing with in terms of SARS-CoV and COVID-19. So, as we start to move forward, we want to make sure our most highest risk populations, have their vaccinations, which is why we have, requirements for healthcare workers who are often critically taking care of people who have COVID-19 as well as other conditions and are at higher risk, to have that in place. And those are the requirements that are in place at the moment. And those will stay, as we continue to see where we land with this. But at some point, the emergency will end. At some point, things will look a lot different. We just don't know when we're going to get there. We don't know what it's going to look like at that time. But we're managing things as we continue to move forward to try to keep people as safe as possible.
Thank you. Dr. Kim, again, a few more questions about schools have come in. One question is, what's the data behind asking children to mask outdoors at schools?
Yeah, well, we actually are following CDC's recommendation, and Dr. Davis had alluded to this, is that, when in areas with high numbers of COVID cases, that we should be considering wearing a mask in crowded outdoor settings and for activities with close contact with others who are not fully vaccinated. And this is where we're at in LA County. We've got highly transmissible Omicron, and we've got a lot of unvaccinated students, especially in elementary school. So at school, masking, just want to clarify, masking is not required outdoors at school unless you can't guarantee that there is a good space between you and others. And obviously, if you have an exposure, the only way you can come back is if you are masked at all times. But in general, that masking requirement outdoors is really around spacing and physical distancing. And masking outdoors is there to really put that extra layer of protection when we're dealing with Omicron, which could transmit both indoors and outdoors. Thanks.
Thank you so much. Dr. Davis, just going back again, would there be some specific conditions of COVID that would entail us going back to stay-at-home orders for certain sectors, for universities? Like, is there anything that you're seeing that would send us sort of backwards to stay at home again?
Not at this time. When we first had stay-at-home orders, recall that we did not have vaccine, and really in a pandemic, when you have a virus that can spread and no one has immunity to, the only things you can do is really keep people separated. At this point, we have millions of people who have been vaccinated. The vaccines have been effective. We don't have a variant that is escaping all protection from the vaccines. And so we're not at that place where we don't have other tools to use in order to slow the spread of the virus. So at this point, I don't see anything to say that we need to go back to that. And I hope that we don't see anything that says we have to go back to that. But that's really why those things were done. There was really nothing else. And if you also recall, in the beginning, we barely had testing available in order to identify cases. So we've rapidly evolved with testing. We've rapidly evolved with vaccines and access to vaccines, as well as in having multiple supplies of masks to be used. So we have lots of tools in place at the moment that, at least right now, I don't see anything that would get us back to that point based on what we're seeing at the current moment.
Yeah, thanks so much. And maybe we got a whole bunch of questions around the Super Bowl. Why are we allowing the Super Bowl? You know, how is it safe to have the Super Bowl? So maybe I'm going to take a stab at this. So one thing I want to note is, you know, LA County is open, okay, and we've been open for a while. 1.2 million people have attended 21 games at SoFi Stadium, with about 70 to 75,000 people attending those games since the fall. Those are the stadium is allowed to operate at full capacity, as are theaters, as are small event venues, larger event venues, movie theaters. But there are some rules in place, and they're the same rules that are going to be in place during the Super Bowl. People going into these large events have to either be fully vaccinated or have a negative test result before they enter the event. They also have to wear a mask unless they're actively eating or drinking. The NFL has added some layers of protection at the events that they're holding, including the availability for anybody to have an antigen test before they enter, and they'll be distributing at the Super Bowl those KN95 masks to every single person that attends, because those masks provide a slightly better level of protection. They'll also have ample compliance staff that'll be there helping to remind people to keep those masks on unless they're actively eating or drinking. And these are the same conditions that we've all been living under for the last few months, during the Delta surge, during this surge, because we now have these new tools, and most powerful among them is the fact that vaccines and boosters protect most people from the very serious outcomes of COVID-19. And that gives us a lot more reassurance that we will not end up overwhelming our healthcare system or having, tons and tons of people tragically passing away. So we are in a different place, but LA County has been open for months, and we are a destination location. We have hundreds of thousands of people coming to LA every single day from all across the world to enjoy everything that LA has to offer. But we also expect when people come here, and this will hold true for the Super Bowl fans and our guests who come to enjoy LA during Super Bowl week, they need to follow the public health safety requirements when they're here. They'll need to be vaccinated if they want to go to any bars, lounges, or wineries, breweries, distilleries. If they're in the city of LA, they'll need to be fully vaccinated to go to just about every indoor establishment, including restaurants. When they go to a Super Bowl experience at the convention center, there too, they'll be checked to make sure that they're vaccinated or they've got that negative test. But the NFL, again, you can go to that Super Bowl experience, a lot of interactive activities. You'll need to show that you're vaccinated or tested. They'll have testing there, so you can get yourself tested. You can get vaccinated there. You can get a booster dose. You can get your first dose, your second dose. And if you get vaccinated, they give you free entry into Super Bowl experience. And then when you leave Super Bowl experience, you'll get a test kit to take home, so that when you gather with your friends for Super Bowl Sunday, wherever that is, you'll test yourself before you go to that gathering to make sure that you're not positive and inadvertently exposing others. So this, people are often asking us, what does it look like to live with COVID? We're all living with COVID. That's what we're doing right now. We're living with COVID. We're doing our very best to add in layers of protection so that much of what we love to do is possible as long as we layer in protections. And the same thing holds true for when the Super Bowl comes here to LA. We're excited. We're excited about the Rams. We're excited about in being able to welcome so many people to this beautiful, beautiful county. But we do have layers of protection that we ask everyone to layer in while we're enjoying ourselves, so that we reduce spread as much as possible. I'm going to go ahead. We've got other questions, but I wanted to get this in because we've got about 25 questions about the Super Bowl. And I want to make sure people understand as well that, the way we're all living right now is we're each making our own assessment about what risks we want to take and what risks we don't want to take, and how we're going to protect the people we love and the people most vulnerable in LA County. And as much as possible, we layer in those masks, we do that testing when we can, we do some distancing, we get vaccinated, we move things outdoors wherever we can so that we can be as safe as possible. But we're back to work, we're back to school, and we're back to enjoying ourselves with many of the activities that are available here. And I think, again, if we each take individual responsibility for making good decisions for ourselves and the people we love, and we recognize that we have a contract with each other to protect those most vulnerable, we're going to continue to be able to be on our recovery journey throughout the months to come, whether we are in a surge or we're in one of those valleys where we have much lower rates of transmission. I think we are making it possible for us to learn to live with COVID. I'm going to go ahead because we've got other questions as well that are, somewhat related, but not, exactly the same. I think, Dr. Terashita, it would be great to hear from you again, similar to what I was just talking about. But how is the county working to decrease the Omicron cases, and how are we getting prepared for the next variant?
Thanks, Dr. Ferrer. Oh my goodness, this is what we've been doing for the last 2 years. So the county has been working extremely hard to decrease Omicron cases. I mean, we do this in a variety of ways. We call it control of disease, and it's through a mixture of mitigation measures. We've talked a lot about those, things like masking, testing, physical distancing, hand hygiene, environmental cleaning, and so on, as well as, prevention measures like vaccination. Vaccination is the most important thing you can do to prevent disease from COVID. But additionally, what we do at the county, you've probably noticed, is we do what we call surveillance. We look at data. We collect data, we interview cases, we look at our data, our trends, what we've seen over time, and we look for anomalies such as the next variant. One of the really cool things we've set up during COVID is genomic surveillance, where we're looking at the whole genome sequencing of COVID virus. So we are looking for the mutations that you hear about in the news, such as the Omicron variant, and now the new sublineages of the Omicron variant, BA2. We are looking for that. We have it mandatorily reportable in our county. It goes to us. Sequences that are done from patients in our county will go to us, and we can analyze them on a daily or weekly basis, where we look again for trends in disease such as spikes. So we are doing a lot of things behind the scenes to protect the county, to protect us from the next variant. Thank you, Dr.
Yeah, no, thank you so much, Dr. Terashita. Ms. Morales-Myers, what are you hearing about when any vaccine for children under age 5 will be available to protect our youngest children?
That's a good question. We have recently heard that Pfizer will be submitting their information for this age group within the first quarter of this year. So once they submit the information, this still requires that a review and approval process, same as we saw for other vaccines. But we're really glad to hear that this is moving forward and is really on the horizon. So we should be hearing more information soon.
Thank you so much. Dr. Kim, do public schools or individual teachers have the authority to demand a level of masking above and beyond what we require, we being the health department? For example, can individual teachers or a public school demand that folks are using KN95s or cloth covers and surgical masks in a classroom?
Yeah, it's a good question. So we at Public Health, we put out guidance, which is really guided by CDC and the state. And sometimes we become more conservative on that guidance, and we are welcome to do that. We can't be more permissive, but we can be more conservative. Similarly, when the field takes our guidance, they're welcome to be much more conservative than us. That is the decision of the facility to make based on your certain context. So in terms of requirements, I think that like if you are a family and you're wondering about this, I think you should be speaking with your administrators to see, how does this differ? Why does this differ from the county? So that you're given an explanation on hopefully it's because it is to again provide a more safer environment for children and staff. But to answer a simple answer to that question, they're welcome to be more conservative than our guidance.
Thank you. Dr. Davis, is there a projected date when we think there'll be better accessibility to, let's first start with, to the therapeutic oral pills that are have been approved, but obviously most people are having a hard time to get them. And then would there be some like sort of over the counter therapeutic pill that we could use to treat COVID? Is that on the horizon? And how would we follow, where do you go to if you want to find out about these scientific developments?
Great question. So just in terms of what's available right now, a lot of it has been very limited in terms of the supply, only because it hasn't met the level in terms of manufacturing to the level that the demand is. I know many of the companies that have medicines that are authorized to treat COVID-19 are working to get their counts of their product higher so that they're much more readily available. In terms of things that would be over the counter, those would have to go through FDA approval and authorization, in order to be distributed. And I'm not aware of anything that is set to be over the counter to treat COVID-19. But I'll also warn that in general, we do want people to be evaluated by the provider to make sure that there are no signs or symptoms that are worrisome that may require a higher level of care. But whether or not we get something over the counter in the future remains to be seen. But in terms of what we have right now, again, the manufacturers are working to increase that. Now, most updates related to new medicines do come out through the FDA, and people are able to sign up for notifications, specifically on changes to COVID medications or authorizations. We have on our website, information on what we call therapeutics for COVID-19 that is designed for the public to know what's out there and where it may be available and what it's used for as well to try to help. So you can go to our website, but for notifications of what's new, I would say sign up for the FDA's website to get those notices.
Yeah, thanks so much. Dr. Teresita, I think we have time for one more question, and so I'll send it your way because I think, again, going back to boosters, we had lots of questions about the boosters. If Pfizer and Moderna are starting trials of their Omicron-specific vaccine, why are we looking at doing boosters now? Wouldn't it be better if we just wait for that new vaccine? So essentially, this person is, I'd rather not get boosted now and just be able to wait and get a more specifically tailored vaccine.
Yeah, that's a good thought, and actually one I've had myself. But the quick answer is that we recommend both. Like, you should get boosted now. There's many, many studies that have shown, and we even presented our data earlier, that show if you are fully vaccinated plus boosted, you are much less likely to, one, get the disease, and far, far more unlikely to get severe disease or die. These are very, very powerful reasons to get boosted. At the same time, yes, there's a new variant, Omicron. And what the best thing to do for a new variant is to make a vaccine that works specifically for that variant. So you have a much higher efficacy for that variant. And we know the drug companies, the vaccine companies are doing exactly that. And there will be boosters, maybe similar to how flu every year gets updated for the new variants of influenza. More to come on that. We're in search for Omicron now. There is no new vaccine, so all you have as an option is boosting, so you definitely need to get boosted, but more to come on what happens with a new vaccine.
Yeah, thanks so much. I think, it's worth noting the approval process is many, many months, and you don't want your immune system not to have the full level of protection it needs to get through these many, many months. So, please go ahead, as Dr. Terashita said, and get yourself boosted. I'm gonna just ask everyone to sort of give some closing comments because we're really at the end of our time. I'll start with you, Dr. Kim, and then we'll just make sure that everyone has time to sort of close us out.
Thanks, Dr. Ferrer. So I just wanted to end by thanking all the families, the students, the staff, the school administrators for your patience, for your resilience, for your advocacy through this long 2-year pandemic and really prioritizing schools. It's amazing to just sit back and reflect that there's 1.4 million students in LA County who are currently receiving in-person education because of your commitment to keeping children in school and making sure that happens safely. I know it's been frustrating. I know that it's also very scary, given all the unknowns, particularly with these variants that are coming our way. But thank you for sticking with public health. Because of this, we have evidence, we have data that schools are safe environments for our children, for our staff, and may even be safer than the community from transmission. Again, we've talked a lot about those layers of prevention measures that are in place both in the community, but at school. I mean, it's a controlled environment, so they have to be there. So just want to thank you for all that you do in keeping, and making sure our schools stay open, and for the children for continuing to come to school. So without the support, none of this could be possible. So thank you very much.
Thank you, Dr. Kim. I'm going to turn to Ms. Morales Myers.
First off, thank you everyone for being with us here tonight, taking the time to do so. I do want to echo that vaccines are safe. And as a parent, I'm going to encourage all parents who have a child 5 years and older to please get your child vaccinated. Make sure you're giving them the best protection that they can get. And you can go to vaccinatelacounty.com to look for vaccine appointments and where to get your child vaccinated.
Dr. Terashita.
Thank you, Dr. Ferrer. Yeah, I echo what was said before me. Thank you all. I am continually amazed, impressed by LA County and the people and the community. We've done a lot. We've been through a lot together. We have a little longer to go, as Dr. Ferrer mentioned. I think Omicron numbers are plateauing and maybe decreasing. So I think we're seeing a light at the end of this most tortuous tunnel. Thank you all. I think we're also very clear. I understand the discussion. I'm happy to have it about vaccines. Are they safe? Do they work? Do we want them? But I think we're clear now that vaccines are the #1 way you can protect yourself, your family, your loved ones, and even just the community. Please do it. Go get vaccinated. Recommend to others get vaccinated. Thank you.
Thank you, Dr. Terashita. And we'll have Dr. Davis close us out.
Thank you, everyone who's joined us. I want to thank my co-presenters and Dr. Ferrer for graciously hosting, as she usually does, and adding comment, so it's not just us talking. But I really want to highlight, the question about what are we doing to slow Omicron spread and what are we doing to prepare for the next variant. The we is really not just us, the public health department. It's also what all of you do and what all of us do outside of our jobs, inside of our jobs. We're actually in this together. And so each of us following our recommendations, following our requirements, and assessing your risk and trying to reduce that risk is really how we get out of this pandemic and how we prepare for the next variant. So all of us and what we do, again, is the most important. Our guidance is our guidance, but it has to be implemented. Our recommendations are our recommendations, but they have to be implemented. So really, I want to thank all of you for doing what you needed to do during this time and listening to us and spending time with us. We will get through this as we have through each surge, and we will get through anything else that comes our way, but we'll do it together. So thank you again, and I appreciate all of you.
Yeah, thank you so much. I want to thank all of our panelists, and most importantly, I want to thank all of you for joining us tonight. We'll be back next month. For those questions that we didn't get to, we will be posting sort of summary answers on our website. So go ahead and look for that in the next few days. And again, Happy New Year. We look forward to continuing to talk with you. If there's any ways that you need our help, please get in touch.